Hello friends, today's our topic is inguinal hernia. So let's learn together. Introduction to inguinal hernia. Let's begin by understanding what an inguinal hernia is. Imagine your abdominal wall as a protective barrier that keeps your internal organs, such as the intestines or omentum, in place. When a weak spot develops in this barrier, specifically in the inguinal region, abdominal contents may push through, forming a bulge. This condition is called an inguinal hernia. There are two main types of inguinal hernias. In an indirect inguinal hernia, the abdominal contents protrude through a natural opening called the deep inguinal ring and pass into the inguinal canal. In a direct inguinal hernia, the contents push directly through a weakened area of the abdominal wall near the superficial inguinal ring. Causes is etiology. Inguinal hernias occur due to a combination of structural weakness and increased pressure inside the abdomen. Lifestyle habits such as heavy lifting, chronic coughing, constipation, or any activity that leads to frequent straining can increase the pressure and contribute to the development of a hernia. Anatomically, a persistent patum processus vaginalis, a structure that normally closes after birth, can leave an opening that predisposes individuals to indirect inguinal hernias. Genetics also play a role, as a family history of hernias may point to a weakness in connective tissues. Age and gender are also significant risk factors. Hernias are more common in males because of their naturally wider inguinal canals. Other contributing factors include obesity, pregnancy, previous abdominal surgeries, and certain connective tissue disorders that weaken the abdominal wall further. Let's now discuss how these factors lead to the development of an inguinal hernia at a physiological level. Pathophysiology and mechanism of inguinal hernia. The development of an inguinal hernia involves a combination of a weak abdominal wall and increased intra-abdominal pressure. In an indirect inguinal hernia, the contents of the abdomen protrude through the deep inguinal ring, which is located lateral to the inferior epigastric vessels. This often happens when the processus vaginalis remains open, a congenital defect, and allows abdominal contents to pass through the inguinal canal. On the other hand, a direct inguinal hernia occurs due to acquired weakness in the abdominal wall. It protrudes medially to the inferior epigastric vessels and passes through an area known as Hasselbalch's triangle. This is more commonly seen in older adults as age changes weaken the abdominal structures over time. Now that we understand the underlying mechanisms, let's explore how these hernias present in patients. Clinical presentation. The most noticeable feature of an inguinal hernia is swelling in the groin area, which often becomes more apparent when the patient stands, coughs, or strains. Some patients may experience a dull ache or a dragging sensation in the groin, which worsens with physical activity. Initially, most hernias are reducible, meaning the protrusion can be pushed back into the abdomen. However, complications like incarceration, where the hernia becomes trapped, or a strangulation, where the blood supply to the herniated tissue is compromised, may occur. These complications lead to severe pain and symptoms like nausea, vomiting, and in some cases, bowel obstruction. Let's take a moment to differentiate between direct and indirect hernias to solidify our understanding. Differences between direct and indirect hernias. Direct and indirect inguinal hernias differ in location, mechanism, and the populations they affect. In a direct hernia, the abdominal contents protrude medial to the inferior epigastric vessels through Hasselbalch's triangle. This type of hernia results from acquired weakness in the abdominal wall. and is more common in older adults. In contrast, an indirect hernia occurs lateral to the inferior epigastric vessels and follows the pathway of the inguinal canal, often extending into the scrotum in males. This type is usually due to a congenital defect, such as a patent processus vaginalis, and is more common in younger individuals, including children. Now that we have understood these differences, let's move forward to discuss the types of inguinal hernias and their complications. Types of inguinal hernias. Inguinal hernias can be classified into three main types. The first is a direct inguinal hernia, which occurs medial to the inferior epigastric vessels and passes through Hasselbalch's triangle. The second is an indirect inguinal hernia, which occurs lateral to the inferior epigastric vessels and follows the pathway of the inguinal canal. This type can extend into the scrotum in males. The third type is a pantaloon hernia, which is a combination of both direct and indirect hernias on the same side, with hernia sacs straddling the inferior epigastric vessels. Untreated hernias can lead to complications. Incarceration is one such complication where the hernia becomes irreducible due to adhesions. Strangulation is a more severe condition where the blood supply to the herniated tissue is compromised, leading to tissue death. This is a surgical emergency. Another complication is obstruction, where bowel loops within the hernia sac become blocked, causing symptoms like vomiting, abdominal distension, and an inability to pass stools. Before concluding, let's briefly examine the anatomy of the inguinal region, which plays a crucial role in understanding hernias. Relevant anatomy of the inguinal region. The inguinal canal is a 4 cm long oblique passage in the lower anterior abdominal wall. In males, it allows the spermatic cord to pass through, while in females, it contains the round ligament. The canal has four walls. The anterior wall is formed by the aponeurosis of the external oblique muscle. The posterior wall is formed by the transversalis fascia and is reinforced medially by the conjoint tendon. The roof consists of arching fibers from the internal oblique and transversus abdominis muscles, and the floor is formed by the inguinal ligament. Hasselbalch's triangle is a key anatomical landmark located in the lower abdomen. It is bounded medially by the rectus abdominis, laterally by the inferior epigastric vessels, and inferiorly by the inguinal ligament. This region is where direct hernias commonly occur. The deep inguinal ring, found lateral to the inferior epigastric vessels, is where indirect hernias begin. The superficial inguinal ring, located in the aponeurosis of the external oblique, is where hernias emerge externally. The inguinal region also has an important blood supply, primarily from the inferior epigastric artery and branches of the external iliac artery. Veins accompany these arteries and drain into the external iliac and femoral veins. Lymphatic drainage is directed to the inguinal lymph nodes, while innervation is provided by the ilioinguinal and genitomoral nerves. Conclusion. Understanding inguinal hernias involves a thorough knowledge of anatomy, causes, and clinical features. Early identification and management are essential to prevent complications such as strangulation and obstruction. In the next lesson, we'll delve into the diagnostic methods and treatment approaches for inguinal hernias. Let us continue to learn